So you have low back pain and you want to get help with that. Why would you go see an upper cervical chiropractor? Because it may seem counterintuitive if you have a primary complaint of low back pain, which I mean primarily down here in your lumbar spine, maybe your sacrum or your pelvis here. So why are we going to talk about your neck? Well, we're going to talk about your neck and your upper cervical spine because the top part of your neck, the atlas and the axis, those vertebrae can misalign in 3 dimensions, where the vertebrae that are really lower in your thoracic and lumbar are more limited to 2 dimensions. So what we find is when your upper cervical spine misaligns, that what it does is it creates these compensatory misalignments below. So here at Atlas Specific, we look at these misalignments down here in the lower part of the spine more secondary to what we would call the major misalignment at the top. Now, that's more of the structural way to look at it. Now, if we were to look at things from a more neurologic standpoint, we're going to come over here to this chart because obviously at the top is where your brain is. You know that your brain controls everything. But from a neurologic standpoint, the higher level of your brain comes down to the lower level of your brainstem, which meets your spinal cord here in the top part of your neck. So that's important because all of these nerves, they come all throughout your body, but especially down here in the lower part of your back, and maybe even the sciatic nerve that goes down through your legs and down to your feet. All of these nerves are all intact in one place up top. So neurologically, we can influence the whole body, the whole neurologic system, by making specific adjustments here in the top part of the neck. What else is important to think about too, would also be the way that your posture is, or the way that most people carry themselves. So if we look up here at this chart, this is just a side view of the spine, which is really just kind of showing some of the optimal curves that we should have. But a lot of people that we see when they come in, we take their cervical x-rays, most people don't walk in the door with a nice, perfect cervical curve. Most people's neck is actually very straight, or it's actually curving forward. Whenever the spine and the neck curves forward, it puts a lot of tension on the back side of the spine, the back side of the spinal cord, which then a lot of that pain and discomfort can actually manifest itself here lower in the spine. Now, I don't want to discount the fact that somebody could have maybe a herniated or a bulging disc lower in their back, maybe just arthritis or degeneration, and that absolutely could be causing some of the problems you may have in your low back. But regardless of what somebody has going on down here, we're still going to take a more holistic approach and a whole body approach by starting at the top, influencing the spine from the top down, and influencing the nerve system from the top down as well. Now, as people progress through their care, maybe like you that has chronic low back pain or even acute low back pain, we absolutely will introduce some gentle adjustments into the lower spine to support the area of injury, but then also to kind of help support the adjustments that we're doing in the upper part of the neck as well.